Hello, everyone, and welcome to episode 31 of the Pet Behavior Chat. And I'm really looking forward to today's episode. So the last two episodes, 29 and 30, we were talking a lot about stress. And I wanted to move from stress to fears, phobias, and anxiety. And the reason that I want to kind of do this episode is because I want to delve a little bit deeper into specific types of fears, phobias, and anxiety over the coming weeks. So specifically talking about separation anxiety, perhaps talking about noise phobias, talking about specific types of fears. So I wanted to use this episode to give a bit of an overview of what actually do we mean when we talk about these terms. What actually are they? Can our pets experience these? How do we deal with them in a general sense? And just give a little bit of an overview like that, because there are some similarities and there are some differences between the three definitions, if you like. And I think it's really important that we sort of understand both the ecological, so the evolutionary, if you like, as well as the kind of the medical or the physiological side of things, because only when we really sort of start to understand that can we think about what suitable treatments might look like, and which those patients might be that we really feel maybe need some support of psychopharmaceutical medication, and how we can kind of move forward with these types of presentations. So first and foremost, I'd say probably fear behaviors and anxiety behaviors are amongst the most common that I see in my behavior practice. So anxiety, I think, as a whole has risen dramatically, or maybe we're just seeing it more. I think in particular as a result of the COVID period, because there are some predisposing factors, that were kind of unique to COVID that may have caused these presentations to increase. However, I do also believe that just as a result of education and better recognizing these issues and being much more aware of mental and emotional ill health in our pets, I think that we're actually just seeing these cases more. I think they're being presented to us more, they're being referred to us more by other clinicians. So I think, all of those reasons probably play together as to why we're seeing a lot more fear, anxiety, phobia-based behavior presentations. So I think let's start with fear, and a little bit similar to stress that I spoke about in episode 29. It's really important to remember that fear is a completely normal response. And from an evolutionary point of view, fear is an extremely important response because it's the brain's and the body's way of keeping us safe, of making sure we survive so that we can pass on our genetic material to the next generation. And essentially our brain's main focus, or its main job or purpose, is exactly that: to save us from danger, to protect us from threats, and to make sure that we survive. And that's why fear is an extremely strong and important response, and a response that our brain will prioritize probably over many other things. Certainly over, decision making or sensible decision making. The brain can then absolutely modulate those fear responses into something else, or it might not be able to. But for sure, our brain's most primitive response is to keep us safe, to keep us alive, to make sure we survive. And fear is a really important piece of that. So a little bit of a sort of a definition of fear. So as I said, it's an emotion that promotes survival. It's what we call an adaptive response. So that's, the body's way of adapting to its environment and making sure it keeps us alive. And I always think of fear and anxiety, which I'll get onto in a second, of having three components. It's got a physiological component. So it's that component in the body, or what happens in the body as a result of your brain perceiving fear. It's got an emotional response. So how does that make you feel? The way we feel when we're scared, I think we might all be able to relate to that in some way. And it's got a behavioral response. And if you think about the behavioral response, that's usually what the muscles do. So fight, flight is your classic sort of response. Your body either runs away from a threat, or it fights against the threat, or it does something else. It moves you in a way that you escape that threat or you avoid that threat. And of course, fight and flight are sort of classic responses, but we also have freeze, we've got fiddle, we've got flock, we've got a whole number of proposed behavioral compartments, if you like, that are all ways in which your body, almost from a musculoskeletal point of view, reacts or responds to perceiving fear or experiencing fear and that experienced threat. Now, fear is quite unique, or it's a little bit different from anxiety in that fear usually passes once that threat passes. So it's very goal orientated. It's very focused on that specific threat. So think about that saber-toothed tiger that comes and chases you. That's that very specific threat. And once that threat has been dealt with and that fear is now no longer, that threat is now no longer a threat, the fear is then also over and your body returns to homeostasis, returns back to a baseline. Now, with anxiety, that's potentially a little bit different. So anxiety is also an emotional, physiological, and behavioral response, but anxiety is more defined as a threat that is anticipated. So it's something that the animal is thinking might happen to it in the future, or something that we might think might happen in the future that hasn't actually happened yet. So it's not that goal-oriented, direct response to a physical or non-physical threat. It's more that kind of feeling of, oh, something could happen, or things might not go well, and that's quite different. And so that means anxiety can also affect our quality of life. So if an animal or a person is constantly scanning, is constantly kind of appraising, is constantly predicting that something bad might happen, that can become quite chronic and that can affect quality of life, definitely. So that's something I think about when I think about my patients. And it can also affect learning. So it can affect the body's ability or the brain's ability to store memories. It could be that the hippocampus is affected in some way, which is that part of the brain that's responsible for memory formation. So anxiety is that perceived threat. However, it also has a physiological, a behavioral, and an emotional component, right? So it kind of responds similarly. And interestingly, when you look at it from a neurobiological or neurophysiological point of view, so that means what happens in the brain, fear and anxiety actually share a few common pathways, but there are also some differences. So the BNST is one of the areas in the brain that is kind of quite specific to anxiety. So that's the bed nuclei of the stria terminalis. So it's an area of the brain that we think is involved with that kind of scanning, that predictive element of behavior, that kind of worrying about what might happen in the future. So we've got some common pathways, we've got some differences. So anxiety and fear are quite similar, but they are not the same. They're kind of two different things. So what does that mean for our patients? And how do we know if fear and anxiety are normal or adaptive responses? So useful, helpful, what the body needs to return back to safety and homeostasis, or whether it's a maladaptive response. That means actually not a very useful and not a very helpful response, something that's actually going to interfere with better choices, better behavioral strategies. And we call that potentially a dysregulated fear response or dysregulated anxiety. And in order to kind of elucidate the difference or to figure out, hang on a second, is this patient of mine just reacting completely normally within that context to that environmental situation? Or is this a maladaptive response? Is this something that's dysregulated? Is this something that's out of the norm and that we really need to think about addressing with a treatment plan? And there are a number of things that I look at when I try and figure this out. So the first thing is the context. Is the response appropriate to the context? So if you imagine a dog and imagine somebody moving towards that dog at high speed with a raised arm, maybe with, a weapon in their arm, and the dog feels validatedly threatened, then the response, the behavioral response that comes as a reaction to that, I would say would be pretty normal, right? Pretty adaptive. The dog in that moment is trying to protect themselves, to defend themselves. It's maybe trying to increase distance between itself and the threat, so it might run away. Or if it can't run away, it might then decide to fight and try and protect itself. So I'd say that that would be, for the context of somebody approaching rapidly with a raised arm, I would say that that's a pretty appropriate response. If, however, we've got a dog who sees another dog a football field away, and that other dog is doing absolutely nothing to threaten our dog at all, and is just kind of going about its business, maybe sniffing, walking far, far away with the owner, behaving completely appropriately, not looking at or staring at our patient dog, and maybe even moving away. And if our patient dog in that context has a big sort of behavioral response, a big fear response perhaps in that moment, then I would say that that's out of context. That's not appropriate to what's happening in the environment or what's happening to that dog. That's not in context, right? So that's the first thing that I would say. Is this behavior contextually appropriate, or is it not appropriate? So that's the first thing. The second thing I would think about is, what about the intensity of the behavior? Is the intensity appropriate for what's happening? So again, if somebody's approaching that dog really, really quickly in a very threatening manner, you would expect the intensity of the behavior to be kind of equal to the threat. So quite intense, right? So maybe lunging, barking, growling, jumping up at, maybe even showing teeth and biting. So the intensity of the behavior would or should be appropriate to the threat. If, again, think about that other dog a football field away, if we have the same intensity of reaction to a stimulus that's really, really far away, that's non-threatening, then you'd say the intensity is probably not appropriate. So that's the second thing I look for, the intensity. The third thing I look for is the frequency. So how often does this happen? Let's say, for example, we have a dog living at home, and somebody passes by the window, and they might be quite a distance away, and every single time the dog kind of sees that, hears that, and has a reaction, the frequency might be higher than we would expect it to be. So how often does a certain behavior occur? And I'll often ask in my behavior consultations, how many times a day does your dog bark? Or how much part of that day, do they spend in a certain state? And the answers I get are sometimes really quite astounding. So that question of how many times a day does your dog bark, I've had people say my dog barks 150 to 200 times a day, and it can then also last for a long time. So again, you need to think to yourself, gosh, is that frequency kind of appropriate or not appropriate? And also, what does that mean for the person living with the dog? So that's, again, something to think about when you're thinking about treatment plans, and perhaps thinking about prognosis or risk assessment, that sort of thing. The fourth thing, and is a little bit similar to frequency, is duration. So how long does the behavior last for? And does it last past that trigger being gone? So let's imagine that dog that sees the other dog across the football field. That dog across the football field perhaps moves away, goes away, and yet the dog still continues to show the behavioral response. And it lasts for a long, long time. So that's the other thing that I think about. Is the duration of the behavior appropriate to the context? And, what does that look like? And then finally, the final piece, so the fifth element that I look at, is the recovery. How quickly can the animal recover from an event, an incident, from a response, a behavioral response to a certain trigger, stimulus, threat, whatever you want to call it. And this is oftentimes where I actually see the first improvements when we perhaps have started a patient on psychopharmaceutical medication, is that all of a sudden we see a quicker recovery, a better recovery. The dog might still respond to something, but the frequency is reduced, the duration is reduced, maybe the intensity is reduced, and they can recover from that event much more quickly. And this is something also that Ilse and I work on with our behavior modification. Can we give them exercises and patterns to do that help them to recover more quickly and to get out of that very sort of reactive emotional response of the physiology and of the brain, to a more moderate, a more appropriate, a more thoughtful, a more cognizant, a more considered approach to the environment and to the context. So those are the 5 things that I look for when I'm kind of thinking about, is this response normal, or is it perhaps not? Normal is not a great word. Is it appropriate, or is it maybe not appropriate? That's perhaps a better way of putting it. Because as we know, fear and anxiety are normal. They're normal responses. So we want to really be able to tease out, is what this animal is doing normal or appropriate for the context, or is it not? And that's going to really influence the way that we move forward and the way that we, kind of think about the treatment plan going forwards. Okay, so that's fear and anxiety. Let's think about phobias. And phobias are defined as an extremely intense response to a situation or something that the animal perceives as fear-inducing. So here we're really thinking about that intensity piece. And if anybody listening has ever experienced a phobia themselves, they know just how intense that can be and how intense also the response and reaction to that can be. And in the realm of sort of veterinary behavior medicine, the most common phobias that I think we see in our pets are noise phobias and perhaps thunder and storm phobias. So they're definitely the most common pieces that we see. And when you look at these animals in those contexts, you can really see how extreme or intense their behavioral response is. Everything from completely shutting down and being almost catatonic to very heightened responses such as trembling, shaking, howling, salivating, urinating, defecating, trying to get away, digging their way out of confinement. And we can really see pets do a great deal of injury to themselves. I've heard of pets that have jumped through windows when there have been noises that they've been phobic of to try and escape that. So it's the intensity and the extreme nature of these presentations that are really, really sort of set them apart. And if you've ever spoken to a person who suffers from a phobia, I think we recognize probably a lot more phobias in people, probably also because they can express and verbalize that better. Then we know quite how intense and how extreme that is. And we see really intense physical responses as well. As I just said, like the hypersalivation and the trembling and the urination or defecation. I mean, these are true physiological responses to something. So that's a little bit kind of the definitions of fears, anxieties, and phobias and how they maybe differ from each other, and how I try and tease out, is this a response that's normal or adaptive? Because we know that these are evolutionary, important and normal phenomena. Or is this, maladaptive, inappropriate, and is this something that we really need to think about from a treatment point of view? And I think the other thing that we also really need to consider is how these animals feel in these moments. And again, it's difficult to, I think, for us as humans to understand it unless we know or have experienced ourselves what it feels like to live with fears, phobias, anxiety, and how debilitating that can be. And I think, we really need to consider that from a quality of life and a welfare point of view as well for our patients. Unfortunately, they can't speak to us. They can't tell us quite how they're feeling in that moment. But in some instances, we do get, very clear communication signals, physiological, behavioral, physical signals of just how they're feeling. So I think that's a really, really important piece. I think living with chronic anxiety, living with, a number of different fears. And, we talk about global fears, being scared of almost everything, anything in the world, or having specific times of the year where, a pet experiences quite frequently, a phobic state, phobias. I think that can be hugely debilitating for the pet, but also for the people that are living with that pet. Because number one, it can be extremely upsetting to see your pet like that. Number two, they do show behaviors that might be really difficult to live with. That might be, if you think about separation anxiety, for example, I've had so many clients that have said that it's really impinging on their own ability to live, do life normally, go out for dinner, go out to the mall, sometimes just pop down to the shop and get a pint of milk, sort of thing. It can be really, really debilitating and difficult to live with these pets. So I think fears, phobias, and anxiety, it's a really big and really important topic from a quality of life and welfare perspective, not only for the pets themselves, but also for the people that are living with these pets. And I think that's something that's really, really important. All right, so let me quickly just go through a couple of kind of classic presentations. And I just mentioned one of them, which are these global fears. And it sometimes can be so interesting when I get a behavior questionnaire from a prospective patient, and the person filling out the questionnaire has maybe said separation anxiety, for example. That's the main reason that they are coming to me, is for separation anxiety, or it might be maybe fear of a specific trigger. Maybe it's fear of men, or maybe it's fear of going outside, or maybe it's fear of going out on walks or specific things in the environment. And when we then start to kind of dig in a little bit deeper, and I kind of go through the questionnaire in a bit more detail, and then I use that questionnaire as a basis for history taking. When I actually then see that patient, all of a sudden we realize, oh my goodness, this patient is not only fearful when left home alone, or anxious when left home alone, but also when they leave the house, also when they go to the veterinary clinic, also when they go to the groomer, also when they go to doggy daycare, also when visitors come to the home, also when they maybe hear noises in the environment, if the dog next door barks. And all of a sudden you start to get a feeling of what this animal's everyday life must look like, living with these global fears that are really kind of give them almost no place of solace, no place that they can go to start them feeling a little bit better, or to help them feel a little bit better. And so I guess, one of the questions is, well, how do pets get these global fears? And I think a lot of the answers here are in genetics, epigenetics, and early life experiences. So we know that we have certain behaviors that do have genetic components, or underlying genetic markers. We know that how those genetics, how that genome is expressed, is also important. That's where epigenetics comes in. And then we have these really important, especially in dogs and cats and puppies and kittens, we have these really important developmental periods, which go almost from being in their mother's wombs, so from in utero up to about 12 to 16 weeks of age in dogs, and up to about 7 to 9 weeks of age in cats. So these really important kind of early life experiences. And then if we think about, well, where do the pets that live with us, puppies and kittens that end up living with us, where do they spend these first 12, 16 weeks for dogs and the first 7 to 9 weeks for kittens? And the answer is a lot of that is not with the caregiver. A lot of that is spent away. If the pets are lucky, they'll be spending that in a really great small breeding operation where the breeders really know what they're doing. But if they're unlucky, they might be spending that in a large scale breeding operation that, then sells to a pet shop. Or, they might be dogs that perhaps have been stray dogs, or that have been street dogs that have, experienced some kind of trauma and have then been brought into a domestic situation. They may have spent that time in a shelter. They might have grown up in a shelter. So it's really important to kind of consider that early life piece of the puzzle. And I think that oftentimes is where some of these anxieties and fears come from. Obviously, we also have learned portions to that. So if a dog repeatedly has a bad experience with something, and that can be a person or that can be a thing, or if there's been trauma around a certain thing in the past, then those can also contribute to that. But the reality of it is that a lot of the puppies and kittens that end up in homes come with baggage, and they may be predisposed to developing certain behavioral presentations in the future, and oftentimes it's through no fault of the caregivers, the owners. A lot of times that's happened really before they've been able to influence the situations. And I think that's also why it's really important that we make sure that caregivers know that in many instances what's happening to their pet is not their fault. Sometimes they've contributed to it, but in the majority of cases that I've certainly seen, it hasn't been their fault, yet they feel so very guilty. So I think that's a really important piece to know. And then finally, the last thing I just want to talk about is some examples of phobias and anxiety. So fears, we've just mentioned something specific or a global fear. Phobias, those kind of noise or storm phobias that I've mentioned as well. And then anxiety, again, we can have a generalized anxiety disorder, which is a little bit similar to global fears, but perhaps more in an anxiety type of presentation. Or we can have anxiety disorders, specific to contexts. So those are some of the examples of those. And the final piece that I want to leave you with is that pets experiencing fears, anxiety, and phobias in many, many cases, I'm not saying in all because we can never say all or never in behavior medicine, but in many, many cases, training alone or behavior modification alone, or even sometimes environmental management alone is not enough to help these patients. Oftentimes, we absolutely need to use psychopharmaceutical medication because we need to influence the neurochemistry that's happening in the brain, and we need to support with some of the things that have happened perhaps during those early life experiences that have caused maybe an inadequate supply of certain neurotransmitters in the brain. So, and I think, this is really important for presentations such as severe separation distress or separation anxiety, phobias for sure, especially those that have these very extreme reactions, and also fear, in many cases, they are just not things that we can train away. And, this is where I think it's so important that we as vets, veterinary nurses, veterinary behaviorists, that we really get involved in these cases, because part of it will be some kind of behavior modification and management piece, but another part of it might really be looking at underlying brain health, brain neurochemistry, and also making sure that there are no other physical health contributors. We know that pain absolutely can worsen or contribute to the experience of noise phobias. We know that, fearful behavior and anxiety are correlated with skin disease, gastrointestinal disease, and pain. Obviously, the big one in there is pain. So, and cognitive decline as well. So, pets that are getting older may experience perhaps more anxiety for a number of different reasons. That could be, again, due to pain, but also maybe due to sensory decline because they can't maybe see or hear as well as they used to, and they're finding social situations and relationships more difficult. So I just want to stress quite how important it is that we as the veterinary team get involved in these cases, and that pet caregivers seek out help from their veterinary teams with this. And education is still a little bit lacking, I think, amongst vets and veterinary nurses, but it's definitely getting better. And so if you don't immediately encounter a vet that is open to thinking about this, then, look for a veterinary behaviorist or look for a vet that is actually interested in behavioral health and behavior medicine and who's willing to kind of help a little bit further there. So that's an overview, a kind of big picture overview of fears, phobias, and anxieties. And as I said, in the next weeks, I'm going to be diving deeper into some of the specific presentations. So we're definitely going to be looking at separation anxiety. We're definitely going to be looking at some of these noise and storm phobias. And we're going to look at also into a couple of other very specific behavioral presentations. So yeah, I'm looking forward to getting stuck into that. I really hope you found this topic useful. It's an interesting one. I think because essentially these things are normal, it's recognizing when they become abnormal or maladaptive that's really, really important. And I hope I've brought that across today. But I also hope that I've conveyed just how important it is for vets and the veterinary team to get involved in these cases, and how important it is that we don't make caregivers feel guilty for this, because oftentimes it's not their fault and it's not something that they've been able to influence. Alrighty, everyone, that is it for this episode, and I look forward to seeing you next week for episode 32. Bye for now.